Welcome to all my dears. Today we are discussing our great antipsoric lycopodium in connection with the cases of irritable bowel syndrome. As you know, lycopodium is a drug which is prepared from the spores of a fungus called club moss. It's an inert substance until it undergoes the process of potentization to reveal the latent curative powers of the drug. More than that, like sulfur, it's a very deep acting constitutional remedy having wide sphere of action. Regarding lycopodium, it positively affects our nutrition, then our GIT, especially in hepatobiliary system. More than that, lycopodium is commonly indicated in urinary or renal issues, then respiratory system, especially with the COPDs, then reproductive system in the treatment of infertility or sterility or erectile dysfunctions, then skin complaints, etc. Here, lycopodium is frequently used in the treatment of irritable bowel syndrome, then nephrotic syndrome, urinary infections, then dyspepsia, or in pneumonia, cases of chronic liver disease as ascites, then skin complaints like eczema, abscess, acne, urticaria, etc. More than that, let me explain a few common indications of this drug. Lycopodium is specifically used to treat your weak digestive system, especially with a weak digestion along with a weak hepatobiliary issues. Here you can see your patient is having most of the complaints are aggravated after or immediately after a meal. A little or few mouthfuls, then the patient will feel a sense of fullness. One or two bowls may be enough too, because that patient feels a sense of fullness. That is, EC satiety is a key symptom of our lycopodium. Here, the patient feels that the abdomen is very distended and bloated. Along with the distended or bloated feeling, patient will have the sour irritations, that is acid regurgitations. Here, indigestion is more in after having food like cabbage or beans or sprouts or after having fatty food also. In such condition, you can see a constant sense of fermentation in abdomen with a ineffectual urging, and the stools are very hard at times and require much straining to pass through, and at times our patient may having diarrhea also. On examination of the abdomen, you can see there is much pressure and tightness in the abdomen. That is not only because of the bloatedness or the flatulence or the fermentation, it may also because of some hepatobiliary involvement, as in case of hepatomegaly, or in case of fibrosis, or in case of chronic liver disease, or in the effect of all this pathology may result in ascites-like conditions. These are the main symptoms of our lycopodium. Next, I am trying to say about urgent nitricum that can be dealt in next class. Thank you.